Following its national executive meeting, the union resolved that classes should be suspended. According to the union, there is no effective teaching and learning that is taking place at schools. It also says that community infections have been increasing since the reopening of schools, and that in South Africa, the virus has moved differently to Australia and Italy. The union says that contrary to international data, South African learners have recorded many infections, with several losing their lives.
The study done presented a picture where indeed the learners in Australia or in Italy were not infecting each other. That is what we were presented with in order to motivate for the reopening of the schools. The South African situation, however, has provided another side of the virus where so many learners have been infected and 7 have lost their lives.
Despite calls for the suspension of schooling, the union says it has told its members to report for duty for the rest of the week.
For now, we are saying to our members they will have to be going back to school. We will advise them. It should not be beyond this week. We are advising our members to stay at schools. By late this week, we should be able to advise them on the next course of action.
Health Minister Zweli Mkhize has, however, defended the government's decision to reopen schools. Mkhize says the decision to resume schooling was not taken lightly and that scientists and pediatricians were part of that decision.
In our case, we have got a crisis on the one side, in the sense that we need to begin to have economic activities to deal with the problems of the food insecurity, the issues of income insecurity, the high unemployment. So in balancing all of that, we have now got to get our communities to learn to coexist with the virus.
Meanwhile, SADTU says it will be requesting a meeting with Basic Education Minister Angie Motshekga to engage on the need to open schools and roll out other methods of teaching. Mahlako Komane, SABC News, Johannesburg.